I'm Carole Taylor, and in this edition of Journal, we wade into the morass of headlines about ER closures all around our province. Nicola Valley, Chetwynd Hospital, Dawson Creek and District Hospital, Mackenzie, Fort Nelson, Kitimat, Northern Haida Gwaii, just to name a few. The worry is that due to the volume of these announcements that we see scrolling across our TV screens every night, we're in danger of becoming numb to the seriousness of this issue. It's not my problem until it is my problem. So let's think about what is actually happening behind the headlines. An elderly man was found on the ground in respiratory distress in front of a closed ER in Merritt. A child in pain from a possible broken wrist late at night finds her ER on diversion, and the nearest hospital is more than 100 kilometres away. ERs are by definition for emergencies, and they can happen at any time, day or night. And unfortunately, so many of these unexpected closures happen in rural areas where options are limited. I know that government's response is to quote the number of hires they've done. But this problem has been a long time in the making, and it's getting worse, causing the mayor of Merritt to plead with government, do something, anything. Causing the mayor of Mackenzie in Haida Gwaii to speak out in frustration, suggesting, well, if Northern Health can't provide the service, maybe independent care providers can. The mayor of Merritt, Michael Goetz, joins me to talk about what it's like on the ground, trying to protect his community and cope with closed or on diversion ERs. Back in a moment. Joining me now, Michael Goetz, Mayor of Merritt. Thank you so much for making time for this conversation. I just have been so dismayed by what's been happening with these rural hospital ER closures. Can you explain to me what it's like for a community when you've got this uncertainty all the time and lack of services? How does your community feel?
The community, you become very aware of the fact that your ER is now not open. Now Merritt, coming from Merritt, we're a very blue-collar community. We have mills, we have farmers, we have people that work with their hands. They're around saws, they're around everything. We also have schools, kids are rambunctious and everything. When the ER goes down, everybody takes a step back and is very careful what they do, because now you're looking at an hour to an hour and a half. Either you're going to Kelowna or Kamloops. One is an hour and 10, one is an hour and 30 minutes away. And that's all fine and good for people who are in great shape. But if somebody has had a stroke, your golden hour is lost by the time you get into an ambulance, and that's the other problem. This becomes like an onion. The minute our hospital goes on closure at the ER, our ambulances now have to start taking patients to Kelowna or Kamloops, which means all of our ambulances and paramedics are now out of the community. We don't have any. So then our fire department becomes pseudo paramedics. They have to now start treating the cuts, the bruises, the suspected heart attacks, and they're on site. Now they are a on-call fire department, because we're not as large as most cities are, which means they can treat and get ready to transport, but they can't transport. So now they have to start calling around looking for an ambulance. So they start calling Logan Lake, Princeton, Penticton. So we had an incident where a gentleman we got an ambulance from Princeton, but that took an hour to get to Merritt to pick him up for another hour to get to Kamloops. Now, when you are taken to another community, you're not necessarily seen first. You actually fall to the back of the queue. And so you could be there another 10 hours before you're even seen. And the other problem that we have is when our paramedics do take someone to a hospital, our paramedics and ambulance don't get released until that person is checked into the ER. So our paramedics and ambulance can be sitting there for up to 8 hours waiting to be released. Then when they get released, BC Emergency Health goes, well, you're in Kelowna or you're in Kamloops, we've got a call over here, you might as well go help these guys. So most of the time we lose our ambulance for the entire day.
I heard someone from the RCMP complaining about this situation generally, saying when they bring somebody in, they have to stay with that person. Maybe it's a mental health incident on the street, but they have to sit there for, you know, our waiting times in ERs, so it's 8 hours, 9 hours. So they're off the street and they're stuck there.
So when the RCMP do a mental health check, it's 2 officers that go. And then if they have to transport 2 Kamloops, they are out of the community for probably up to 6 hours. So that's another issue with the ER closing the RCMP with a mental health check. We do lose some of our RCMP.
You must see that in the stress of people in your community.
There is stress, but there's also the fact that, case in point, I was talking to one of the reporters at CKNW. He had a call-in show, Mike Rowe, I think it is. Anyways, one of the gentlemen from Merritt called in, and he was a logger, and he broke his thumb at home. And rather than taking the ambulance ride and everything else, he just reset it in the shop. And that's what we're getting to a certain degree, where the smaller things, you just go ahead and take care of yourself now. And that's not acceptable any longer. So, I mean, he laughed it off. There are some people that will do that. But that just goes to show the systemic weakness of this whole process. When somebody actually goes, well, I think I'll just reset my own thumb. Or you see a headline that says, ER AI is now being considered. So you're going to have a surgery through your Apple computer for yourself, like a home surgery kit.
Black humor, huh?
Well, but it's out there. It's being talked about. It's being released by actually the ministry is talking about it, and you're like, this is not the way it should be.
You famously said, don't get hurt, don't have a stroke, don't have a heart attack.
No.
Wait till Monday.
Well, you have to. And that's kind of where we're at this point in time. Is like you have to be very careful. Case in point, we had September long weekend was the 67th annual rodeo, and the day before I get told there's no ER is going to be closed. We've got people riding bulls, steers, the whole bit. We've got absolutely no hospital. They did the same thing for Base Coast. We had 10,000 people in town. Hospital went down that weekend. So luckily for myself, I contacted the president of the Ambulance Association, and they managed to have 2 teams of paramedics there, but still somebody would have had to been transported to Kelowna or Kamloops. So our ER was down. It goes down on very important times when we actually need it. And one thing about your ER going down is it can affect the investment in your community. It really can. I get a phone call, first thing that I get asked is, what is there for my kids to do? And I hear you're having problems with your hospital. That is the first 2 things I get asked. So it does start to affect your investment in the community. And it is something that has to be looked at because it is hampering investment in the smaller communities.
How many closures have you had this year?
12. 19 last year, 12 this year. So if you take 24, or what are we at, 18 months, we've been closed for 1 straight month, basically between the 19 and the 12 this year. So.
And someone who was quoted in the paper from Merritt said that when their daughter had a problem, it was late at night, and he checked on the internet to make sure that it was open. And it was quite a drive, and he gets there, and it's closed, but it wasn't on the internet even. So you don't even know if it's going to be closed sometimes.
Well, the minister has said that most of the time, a lot of the closures come with hardly any notice at all. That does happen very rarely. I'm well aware of 7 days before our hospital goes down, or our ER goes down, from my director from IHA. I call her every week, and we talk about it. She says, the 24th, you're going to be down. So we already know we're going to be down. So these are not sudden closures, as we've been led to believe. I know 7 to 14 days before the closure that they're closing down. And it's normally always a weekend, normally.
And so you as mayor put the word out?
I've put this, I've questioned that. But the other thing that I've said too is, these are doctors and nurses that have a life. Why should they be forced to work 36, 48 hours to keep a hospital open? This is the province's position to keep this working, not doctors and nurses. They have a life. They want to see their kids grow up. They want to go to a recital. They want to go to a Christmas engagement for their children. They want to take a holiday. But yet they're forced to work these hours to keep the hospitals open. And at some point, they say, no, I can't do it. So they take the time, deservedly so. You can't ask. We are still 44% shy of our nurse compilation in Merritt. We need 44% more nurses than we have. So that relies on the other 66% of the nurses to carry that load. And sometimes it gets a little much, especially if they have children.
You frustrated?
No, you know what? There's some cures to this. I'm not frustrated. I'm waiting for a plan to emerge. By now, I would have expected the minister to have a plan. Like, I've been very vocal. I've sent a bill in. I've asked for...
Let's talk about that bill.
Yeah.
How did you decide to do that, and how did you get the number?
So what we did is we took the size of the hospital, because the hospital is actually open when the ER is closed. So you can't take the 100% of the hospital closed. So the ER takes up 5.2% of the hospital square footage. So we took the 5.2% of the ER and times it by the 19 days on what that would look like and what we would pay. It works out to about $1,800 a day. And that was 19 days. So our bill came out to about 48,000 something or other, but then also we had to take in the consideration of the fire department going into their budget, $55,000 to cover when the ambulances are down. So with GST and naloxone used and everything, it came up to $103,840.
And the point you were making is we didn't get the service, so why are we paying for it?
Well, that's the thing. We pay for these in advance. I think our bill is $650,000 a year that we pay right at the beginning of the year. And then we expect 365 days coverage. We really do, because we've prepaid it. But when this happens, we had to raise our taxes by 1% to cover the cost of not getting that service. So in essence, our people have actually paid for this service now twice, because we had to go up a 1 full percent range to cover the loss of the $103,840.
So you sent the bill in. What happened?
I'll be talking to the Premier tomorrow. We have a face-to-face tomorrow, and I'm going to ask him, I know he's busy. It's that time. I think the writ gets dropped this Saturday. I know he's super busy. I gave it to him July 11th, and I haven't heard anything back. I was going to send it to collections, but I thought, you know what, I'll wait till after UBCM. I'll have a meeting with him tomorrow, and I'll just ask him straight out, yes or no. That's all I'm looking for. I'm not looking for cash back, just a credit coming into the next year. Because I've already let him know that we are already now working on the credit for 2025, because we're 12 days into 2024 of closures. So he can either answer me yes or no tomorrow, and that'll be that, and then we'll talk about it after that. If not, it'll go to collections.
We're going to take a short break, and then we'll come back and talk about possible solutions. Mayor Goetz from Merritt is going to talk a little bit more, not only about the problems this community has with ER closures, but maybe some possible solutions. Now, you teased us a little bit saying you're expecting a plan. What form would you like that plan to be?
Well, I think you would find at this point in time, most mayors that are experiencing shutdowns, in August in Interior Health and Northern Health, we had 54 hospital shutdowns in 29 days. In July, we had about the same. That works out to $100,000 a month times 12. That's a little over $1.2 million that has been paid that has not been received. So plans such as return on investment, second-year nurses, four-year nurses, they do get some grants that are non-payable back. We need at least 2 years of return of service before they are headhunted out of the country. But we also need to look at a situation like Depot with the RCMP, where they are assigned a hospital for those 2 years, whether it be up north or smaller cities like mine. Now, I understand. I have two nieces. One works at Surrey Memorial, the other in Vancouver General. I'm very proud of them. But when they go through their training, they have rotations, pediatric surgery, physical, whatever. They go and when they graduate, they really want to use this stuff. And then they come to Merritt. Well, no babies are born there. There's no surgeries there. There's none of that there. So you're ready to go, and you can't use any of this stuff. So my situation would be we don't want, not that there's anything wrong with the younger nurses, but we would like the nurses that are 5 years away from retirement, that are done with the babies, that are done with the surgeries, that are done with the real physical stuff. They just want to be able to still use their craft and then get people ready to go to a bigger hospital if they need it. So that's what we're looking for, are nurses that are kind of on the downhill slide of their career, where they don't want to, because getting younger nurses to come into a small town or a small city like Merritt is harder. Oliver has issues. New Denver has issues. Even Williams Lake has issues. So those are the kind of things that we're looking at. And I think mayors that are experiencing this, if we had a plan, even if it wasn't the best plan in the world, and we knew that it would take 1 to 2 to 3 years, at least something we could get behind that we'd say, okay, we'll start to see something in 2 or 3 years. Right now, we don't have that. All we get is we're throwing everything we have at it. What does that mean, actually? What is everything? Or we just spent $155 million. On what? Tell us what you spent it on. We've got 1,000 nurses ready to go. Where? We haven't seen. If you've got 1,000 nurses ready, we're ready. I'll take 3. but we just haven't seen that. So empty comments like that don't go well with mayors and council to keep the hospitals open. But if we had some concrete numbers, we have this many graduating this year, we have this many graduating this year, we have so many doctors coming in out of country, out of province, or in province, issues like that. But we're just not seeing any kind of a plan. We're just going on the same tired rhetoric that we continue to have heard for almost 2 years now.
You just mentioned out of country, and this one has always, it drove me nuts even when I was in politics. But the fact that we've got the most highly educated cab drivers, many of them doctors, we've got nurses who, fully trained and worked in LA, they come up here because their husbands moved, and they're not allowed to work here. We have a lot of talent, but the system requiring doctors to basically re-educate and do boards again, and even a nurse, and this one I knew personally, a nurse came up, she had been trained in LA, and somehow they were saying, well, we're not sure about the training. Really?
We have a doctor in Merritt that has 30 years ER trauma surgery. He volunteers in Fraser Valley Health every single weekend to help so they don't close down. IHA will not let him volunteer up at our hospital. He's offered to do it for nothing and just simply will not do it. This is why I'm also suggesting that we go back to the future. Let's put hospital administrators back in the hospitals. IHAs have too much power at this point in time, or HAs have too much power. They really do. There's too many CPAs, CGAs that are running our hospitals now. You can't have people without some sort of a medical background running how your hospital is going to go. I sit on TNRD. The cancer center in Kamloops is $40 million over budget. How did that happen? So again, we need to go back to the situation where we have hospital administrators that can actually administrate the hospital and keep things moving.
And so are they the decision makers? When you say, for instance, you would like to bring in older nurses, you can't hire them. So it's the health authority that hires them?
It would be the health authority. I mean, if you look at it right now, we're dealing with a group in our town called Shwakam Health, and they're bringing in doctors, but it is First Nations driven. But they're bringing in doctors for the entire community. Now, they've been successful with now 2 doctors, and we should see another one by September. So I would say if they're having the success that they're having, maybe tap into that brain trust, find out how they're doing it, and then do the same thing with your situation.
You're certainly not the only one who is suffering with this, trying to figure it out. The mayor of Masset, she was so upset that she said, well, with all of these closures, if Northern Health can't figure out how to keep our ERs open, maybe we should get private care to do it. Do you think there's any possibility of a stream of private care support?
Well, I think to a certain degree right now with the hospital incentivizations where nurses get paid to work more at this hospital and doctors get paid more to work at this hospital, you're getting very close to fee-for-service. So, but that's not going to do well for those who can't afford that situation. I understand private health care, but you have to remember this is universal health care and it should be for everyone. If someone is able to afford it, great, but somebody who can't, it becomes a barrier. So I think that's something, maybe the most drastic situation. I mean, in our area, there are imaging clinics that are private. If you do not want to wait, you can go and pay your money and get it done. Maybe that's something to look at, but I'm not a big fan of private health care.
Then one model that is possible, because the government already does it with certain surgeries, is that it's a private clinic that does them, but it's the government that pays and everybody goes. So I'm just thinking if Northern Health couldn't figure out a plan, or if the mayor of Masset believes that there's another way, maybe they should look at, the government still pays, but they would pay the agency to make sure the ER is always running. I
think anything on the table right now would be well looked at. I mean, we're at the point now where, like I say, 54 closures in IHA and Northern Health in 30 days, little over $100,000. It just, anything now, any plan I don't think would be not a plan to look at.
So where are the pressure points? You're a politician, you have to kind of find who's the decision maker or whom you can influence. From your point of view as a mayor, or for all the mayors if you get together, where's the pressure point?
Well, for me, it's the Premier. Premier's the coach. This is a team. The Premier's the coach of this team. When you have a weak link in your team, you either replace it or you do a JWD, job worth doing. So myself, don't get me wrong, Adrian Dix has had his time in politics, and I give him respect for it. It's a lot of hard work he's done, and he takes a lot of slings and arrows. But maybe it's time for a new set of eyes. Maybe it's time to have one person step back and somebody else step into that position. But that's on the Premier to do that. I mean, clearly, it's very obvious that the system is not working by the person who's running it.
So do you think this will become an election issue?
I said that 18 months ago that this would be an election issue, and it will be.
And so are you coordinating all the mayors in rural areas?
Tried to, but I very early called for the return of, or lifting of the mandates. That kind of turned me into a black sheep a little bit. So a lot of people didn't want to associate with me at that point in time. I called for that in February 2022, that we should have the mandates lifted. And I mean, I got vaccinated and everything, and it's fine, but it's just that the rest of the world had moved on. I kind of felt that we were dragging our heels, and I have several doctors that have live in Merritt that went to Calgary that want to come back and will go back to work if they could have the mandates lifted. So I could see 2 or 3 of our doctors actually returning. So I asked early on for that.
And so the election is basically upon us.
Yes.
We're in it. What is your plan? Do you have a strategy for getting these stories out to the press once a week, or do you have a plan?
I've been harping on this for close to 18 months. I've asked for some changes to be made. I've asked for plans to be made. I've sent bills. I'll continue while we're here. This is the perfect venue. We wanted to see Minister Dix. He refused us. He refused TNRD to talk with him as well, and basically because he knows he's going to be talking with me, and we don't get along all that well because I've been fairly blunt about his position and where he should or should not be, and I firmly believe that we need to have somebody else there.
Well, black sheep or not, I think you've got great guts and you're standing up for your community. Thank you for joining us today.
Well, thank you very much. Appreciate it.
We'll be back in a moment. It's time to look at innovative solutions to the crisis we have in our ERs right now. Are we making the best use of our nurse practitioners? Why do so many foreign-trained doctors end up driving cabs? Are the incentives we offer for rural doctors and nurses sufficient? One thing for sure, we can't wait for the long-term education of more professionals before we act. Let me know your thoughts on YouTube. Till next time, I'm Carole Taylor.